Okay, so let's take a look at this video. This is a very, very important video, so thank you for sharing it. It's all about a baby being unwell and being investigated for an illness. So I'm Dr. Hassan-Ali, a double board certified pediatrician, and let's talk about red flags in babies. So very easy, just remember this mnemonic, A, B, C, D, 2, T. A stands for activity, so every baby should be moving, active, and alert their hands and their feet. One red flag to look out for is if your baby's extremely tight, either of their hands or their feet, and it's really, really hard for you to actually pull them out of it. Another red flag is if they're very floppy and very lethargic. So babies can sleep up to 19 hours a day, and that's totally normal, but generally they wake up for feeds and they're still alert around you. But if you're struggling to wake up your baby and your baby is very flat, has no life in their limbs, you do need to seek attention. So B is for breathing. So babies can have different breathing patterns and sometimes they look unusual, but they can be entirely normal. What is a red flag to me is one, apnea. So essentially, if you don't see any chest rise for about 10 seconds or longer, that's a red flag. Another red flag is if your baby is struggling to breathe. So if you see your nose flaring, your trachea tugging, or if your child is sucking in their breath and you can see their rib cage, red flag. So C stands for color. Your baby is very bright yellow or very pale and looks like a ghost or has blue mouth and a blue chest. Those are concerning features. So D is for dehydration. So as your baby gets older and they're learning how to feed, they should be able to pee and have reasonably wet diapers. If your child is not having any wet diapers and you find that their skin is very tight, especially when you pinch them and it takes a while for that to smoothen out, that's a concern. So one of the T's is for tone or movement. So babies who have seizures, that's a red flag. And that can look like your baby is vibrating and they're very hard to console, or they're posturing and it's quite abnormal. Sometimes seizures can be associated with lip thrusting, cyanosis. They can also be quite lethargic and quite tired. And so those are concerns as well. The last T is for temperature. So any baby that has a fever, which is greater than 37.5 degrees Celsius or 99.5 degrees Fahrenheit, needs to be seen urgently. If you are going to be using a thermometer, the best is a rectal thermometer, but if you don't have one or scared to use one, you can always use an armpit thermometer. Any baby less than 3 months of age should seek medical attention immediately if they have a fever, and that's usually because they're at a higher risk of infection and higher risk of severe infection. Make sure you follow Peds Patrol for more tips.